health ministry, then animal and welfare, animal husbandry and fishery, then agriculture ministry. So as we are discussing in the morning, the antimicrobial resistance it is not related with the human only. It's the use of antibiotics in the human. But the reason behind the antimicrobial resistance is along with the utilization of the antibiotics in the human as well as it is used how it is used in the human animals and into the agricultural products. So overall, so because of that, this declaration has been signed by the various industries. So we know that it is not the strongest the species in the species that survive or the most intelligent species survives. The species which survives is the most responsive to the change. So who are able to change continuously, they will survive. And this is the strategy why the antimicrobial resistance is developing and it is still a big problem and it is not going to be end until we will not control it because it is going to be जितना हम चलेंगे हमारे साथ साथ एंटीमाइक्रोबियल जाएगा सो जितना हम कंट्रोल करेंगे वैसे ही एंटीमाइक्रोबियल रेजिस्टेंस वी कैन कंट्रोल वी कैन नॉट नलिफाई द एंटीमाइक्रोबियल so studying this from morning so this is the background information what we are in today's that what is the cause of antimicrobial resistance? The antimicrobial resistance is the ability of microorganisms to resist the effects of antimicrobial drugs. And the reasons for that are poor infection control or sanitization. So as we know that in infection it is one of the most bigger problem, which is one of the cause of infection. Then antibiotic overuse. So whenever we use, if we have any normal respiratory tract infection, then not the layman person also goes to the medical shop and ask for azithromycin and ask for amoxicillin. These cephalosporin antibiotics are also commonly dispensed without prescription, and this fad, I will say fad, this fad is increasing, but not only by the pharmacists and by the people also after the COVID. Now the people are avoiding इसके स्मॉलर इलनेस है इसके लिए डॉक्टर के पास जाने की जरूरत नहीं है फार्मासिस्ट क्लियर कर सकते हैं तो फार्मासिस्ट के पास अब गोलियां कितने रहती हैं एक दिन के लिए दो दिन के लिए एंड बिकॉज दीज आर this viral infection they can cure itself which does not require antibiotics so either they will take one or two tablet or 1 or 2 day tablet so they feel that कि ये हम यूज कर रहे हैं इससे कम होगा तो नेक्स्ट टाइम दे यूज द सेम मेडिकेशन so that's why it is not working we are not going to control for this and genetic mutation in the microbes what we have learned by the professor in the morning the reason behind the antimicrobial resistance and lack of investment in and R&D for so as we in last 1 decade I think the first antibiotics is developed that is also by India in last year. In last decade में नया एंटीबायोटिक मुझे तो याद नहीं कोई डेवलप हुआ है. Then in so recognition by WHO it says that antimicrobial resistance is threat for global threat and that's why they have launched the global antimicrobial resistance and use of in 2015. The impact of antimicrobial resistance rate of infection make infections hard which ultimately having the so examples like stop responding to the antimicrobial resistance due to the antimicrobial in the Klebsiella pneumoniae, antimicrobial there is rifampicin resistant tuberculosis. Sir has given us अब हम लोगों ने देखा 2 tablet or 3 tablet. It goes to the multi resistance. We are not able to उसका हाथ भरा हुआ है pump with the medicines because of antimicrobial resistance. Increase the cost for the treatment. Drug resistance in H. Drug resistance in infection. That the surveillance resistance India has reached antimicrobial resistance, and for that surveillance of microbes in tuberculosis like malaria. National action Act 17 India has started with one and antibiotics to the ICM. We have discovered now terminology because in the from the so antimicrobial resistance we have already that is it is no longer response of the medicine and this infection happens to the causes of infection are genetic basis external resistance either natural or acquired. And the reason behind that causes of misuse and lack of clean water, sanitary infection prevention, and lack of awareness. So this is also healthcare. Background history also we know that I am going to forward this. So high rates of antimicrobial resistance we are already aware about this. This high rates why we are concerned about this antimicrobial resistance because one high rate that going to be increased continuously. Then it is a high burden for the treating the infectious diseases. It is unregulated, and we don't have any regulation for prescribing or control over the prescribing of antimicrobial resistance. So as I said, sir is going to be discussed about the H1 regimen, but H1 schedule. But most of the people are not knowing about the earlier one there is H. So some people are knowing about H, but there is a H1. There are some guidelines regarding how to use this H1. What are the prescribing guidelines? So antibiotics are prescribed without any prescription, and we don't have any surveillance over that. We don't have any regulation. Though we have regulation, but it is not. We don't have any control over this regulation. That is a major problem. That's why we need to concern about the antimicrobial resistance and the lack of surveillance and monitoring of this antimicrobial resistance. And for that, now government of India step by step, slowly, starting from educating the people and the prescribers also, is in government of India is taking the steps for one slowly, and from 2016 we are starting the national action plan that is NAP for antimicrobial resistance. NAP is to increase awareness, strengthening the surveillance, promoting the infection prevention and the control. The first step they have taken, that is the signing of antimicrobial resistance. Yes, sign that in the Riyadh, one in Jaipur, in there, which is done by Jaipur Global, which is WHO. Recently in 2017, India has signed the Delhi Declaration of Antimicrobial Resistance. The aim of the declaration is to address antimicrobial resistance mode to research initiative, to the civil society, industry, small and medium-sized enterprises, and encouraging public-private partnership. Then, for that, so they have initiated the antimicrobial stewardship program by the ICMR, the Indian Council of Medical Research, which was initiated this antimicrobial stewardship program. And this program is aimed to control the misuse and overuse of antimicrobial agents in the hospital and ICU sector. Then, along with that, how we can control and what is the aim, how it is done, the detail we have already learned that the ban on the inappropriate feed dose combinations, ban on the use of clostridium and growth promoters in the animal feed. So this is regarding the agricultural use of the agricultural and animal use of the antimicrobial agents. Then One Health program where the government is working on the One Health approach of encouraging the interdisciplinary collaboration of the human, animal, and environmental interface. And are included like zoonotic diseases, food safety, and antibiotic resistance. So integrated one health surveillance network of antimicrobial resistance is started by ICMR, which is under the project which is called Integrated One Health Surveillance Network of Antimicrobial Resistance in collaboration Indian Council of Agricultural Research to assess and preparedness of Indian veterinary laboratories to participate in the integrated antimicrobial resistance surveillance network. And so for that, then the global action plan is there, which is signed by the G20 nations, and international funding mechanism has been we have raising for developing newer antimicrobial agents and also to control the antimicrobial resistance. And for that, national action plan has been made for with the 6 strategies. One is awareness and understanding for the community and the education, and in which their main aim is educating and training the people, both professional, that is doctors, and the patient, both. Then knowledge and evidence, the surveillance of antimicrobial agents, which control the surveillance over the human, animal, and environmental use of antimicrobial agents. Then laboratories, the infection prevention control, where healthcare system, animal health, and community environment. Then optimize the use of antimicrobial agents, the regulations, rational use according to the policies of the antimicrobial use, antibacterial stewardship programming to the human beings. Then innovations, that is producing newer medicines, innovations and financing to develop newer antimicrobial agents or the avoiding the antimicrobial resistance, and leadership into national collaboration, state collaboration, and international collaboration. So this is what we have discussed. And now, what is the daily declaration? It includes daily declaration. It acknowledges the resistance of antimicrobial resistance is the matter of seriousness due to inappropriate use of human use of these antimicrobial agents in the human, animal, and even in plant and agricultural sector. And for that, it is one of the they say that it is the greatest and most urgent risk to require the focus for the control or immediate action or attention has to be taken for the antimicrobial resistance. They also recognize this that it negates many 20th century achievements, particularly in the particularly in the reducing the reducing the health sector, where illness infection control is not, we are achieving our targets because of this antimicrobial resistance, and they are recognizing, they accept it that because of antimicrobial resistance we are not achieving our targets. And they also project antimicrobial resistance is a project to cause millions of deaths worldwide, even in India, with a massive social, economic, and public health repercussion is there. They also realize that this emphasis required the coherent, comprehensive, and integrated multi-sectional actions. And for that, they have some what we call global action. We say that is reform, or they also global action program where they aim that there is till 2030 they should control 10% reduction in the mortality of due to the antimicrobial resistance, 20% reduction into the inappropriate antimicrobial use in India in humans, and 30% reduction in the inappropriate antibiotic use in the animals. So this is the target they have to control the use of antimicrobial resistance, antimicrobial use either in human and animal, and to control the antimicrobial resistance. So they want to decrease the death which occurs due to the death occurs due to the antimicrobial resistance at least 10% of what is now. Then they want to control the inappropriate use of disease use to less than to control that of 20% what we are having, and reduction of 30% use of antibiotics into the animal. They also in national global action plan they also improve the awareness and understanding of antimicrobial resistance through the effective communication, educating and training, strengthening the knowledge and evidence to the surveillance in all sectors, that is in human, in animal and agricultural sector. Then they also want to reduce the incidence of infection in healthcare, animal health, and community and environment setting through the effective infection prevention control. Again, in that also they want to optimize the use of antimicrobial agents. Again, in human health, animal, and agricultural products with the focus on strengthening on the regulations, that is to assess and surveillance over the use of the antimicrobial agents. By the in human, we have antibiotic stewardship program, which in further step they are going to be applied on the animal health also and in agriculture also. They want to promote investment into antimicrobial activities for the research and innovation which focus on the development of new antibiotics. They want to strengthen the Indian leadership of antimicrobial resistance with a focus on international and national, along with the pickup it from the state and district level. So these are the national program, that is to increase. First step is to aware and understanding about what is antimicrobial resistance. That we are in the first phase. What we are going to be ignite today. Then the knowledge and evidence, to increase the knowledge and evidence. So infection and prevention control, optimal use of antibiotics, with one innovation and having some investment over the research and development. And last one, to lead the global, lead India for to control the antimicrobial resistance in the international level. These are the four 6 steps planned for antimicrobial resistance control by the government of India, which is the declaration, the Delhi Declaration, which is signed by the India. Thank you.
Thank you so much for the introduction. To my request, Riti ma'am, please. So, sir, nicely in detail will explain the national action plan, antibiotic policy. Since morning we will discuss about the antimicrobial resistance, and this part was regarding the government measures or key initiatives. So, my last topic for this conversation is just the schedule H1 and the deadline. So, actually, regarding that rate line campaign, I just need to know why we get this line. Because actually, I was honestly, I was not doing by actually rate line. I used to buy the drugs, they went the rate. I was aware of single issue, but I was not aware of rate line. So that is only two slides I will just keep it. For getting drug, over the digital tax, there are red lines, that means those are the drugs which are discussed only are the certain registered medical practices description of it. And schedule H1 is just a subpart of the H, where there is registered medical practices description के बाद भी उधर डिस्कस किया जा सकता है. उसमें H1 क्यों बना है? H1 just to prevent the antimicrobial resistance of certain antimicrobial drugs which are reserved for certain diseases like leukopsin, which is preserve as second line, but you don't know. Both areas, like conventional superspace, and some other drugs which are called as the psychotropic drugs, psychotropic drugs like sleeping pills like Norpidine. Those are also covered under yes, narcotic aid. So those are student aid for. यहाँ पे गाइडलाइंस क्या है और जो प्रिस्क्रिप्शन आया डॉक्टर साहब उसका एक जीरोक्स कॉपी बीटी वाले में मेंटेन करते हैं let's take the session of this right this is the chronology of the activable the business related key initiatives taken by the globally by the different governments different agencies like WHO as well. Started from the National Task Force in 2003, India started national policy in 2011.